some of you, I think probably all of you would be the closest to, potentially. And yeah, Andrew, he's our pharmacist, licensed pharmacist at the Cranberry location, and he's going to take you through a little bit of the program, the Pennsylvania program, the history of it, as well as dive in a little bit more detail. We definitely want to save time for questions. Whatever you have to ask, please just ask us. We have literature here, how to become a patient, how to become a caregiver in the program, what to expect when visiting any Solevo dispensary. We call it the Solevo Way. It's this is how we operate. And then another brochure over here that you can take with you. We can pass those out later. But I'll hand it over to Andrew now. And any questions, please throw it out there. Thank you.
Hello.
Good morning.
My name is Andrew Butcherelli. I'm the pharmacist, and a real pharmacist. I get that question a lot because I'm in a medical marijuana dispensary. I was in retail for about 10 years, so I understand the traditional medicine side of it too. I've been a pharmacist for about 3 or 4 years, but I was an intern and I was a technician before that. So is anybody familiar with the medical marijuana program in here? A few people. So what I'm going to do is basically talk about the medical marijuana background, how to get the medication into your system, more specifically for Parkinson's disease, because I'll show you there are 21 different disease states that you're qualified for, and then what to expect when you get to our dispensary. I'll walk you through that too. So some of the states allow recreational use, where you can just go into a dispensary and purchase something. Some states don't allow anything, where there's no marijuana available, except for recreationally. And Pennsylvania is one where either a caregiver or a patient can come into a dispensary to get the medication that they need. So there's a lot of different disease states. It's probably hard to see. There's 21 different disease states. I bolded the most common ones. So Parkinson's is one of them. Severe chronic pains here. I see that pretty much all day. Most of the patients that I sit down with are dealing with chronic pain. Epilepsy, cancer, especially people battling cancer and they have nausea and vomiting. So a lot of people will ask me how the marijuana, where it's grown, and how it gets to our dispensary. So everything in Pennsylvania has to be grown in Pennsylvania. And then it is tested for the cannabinoids, or the active ingredients, and making sure it's safe. So they have to make sure there's no pesticides, herbicides, anything that would harm the patient is eliminated, and then we get the pure product. And that is not opened until the patient takes it home. So it's not manipulated by us at Solevo or any other dispensary. And cannabinoids, like I said, are just the active ingredients in medical marijuana, so that's what I'm going to talk about next. It's probably hard to see back there, but THC and CBD are the two main ingredients in marijuana. There's other ones listed around here, and they just add to what we call the entourage effect. So they're usually helping calm down the body, restoring balance, which is usually pain relief, or when the body gets hyped up, it's just restoring a more calming balance. The major difference between THC and CBD is that one is psychoactive, so it gets to the brain and causes the euphoria, and that would be the THC. And CBD is non-psychoactive, so all that means is you're very clear-headed while you're using that product. And CBD is actually available at other medicine shops or whatever would be over the counter. You don't actually need a caregiver or a patient card to obtain that. So,
Excuse me, the CBD,
mm-hmm.
you see these, they're popping up everywhere. How do you know that that is the true, there's not a lot of additives to it, that it's safe to take? Is it grown in, does it have to be grown in Pennsylvania?
So anything in a dispensary that has CBD in it, and yes, we have some products that the CBD outweighs the THC by quite a bit, those are tested and verified and produced on the label exactly what you're getting. There are some other companies that are just over the counter, and like you said, you could go in and buy that. They're supposed to be tested, and they are tested, and there's probably more reputable brands than others,
Yeah, just to interject there a little bit, you can go to 7-Eleven and buy CBD. You can go to different areas. You don't always know what you're getting.
Yeah.
You don't know if it's been tested. It might say they're tested. The thing that I find, and we get approached by CBD companies all the time, we're not allowed to carry straight pure CBD because no growers in PA are doing that right now. Everything we have has some sort of THC content in it, although it could be very low. He'll go over how CBD actually counteracts THC too. But one thing I have found that was interesting is when people talk to us about CBD, it's the same pitch regarding where they're from. If it's a reputable company or if it's somebody we don't know of, they're like, make sure you know it's tested. Make sure you go with the brand that you know what's in it exactly. Well, how do we know, right? There are reputable brands that aren't in Pennsylvania, from Pennsylvania. Charlotte's Web and Colorado and things like that. Those are names that you could Google that people do order and get them, and they use them in conjunction, say, with products that we have. So it's kind of the Wild West if you think about it with CBD right now. Everybody wants to get into it, and you don't know exactly what you're getting most of the time. So just kind of be careful. Do your own research. Look at the websites of these companies to make sure. Maybe if you Google something like top, reputable CBD companies in the United States, you probably find something called Charlotte's Web or Palmetto Harmony. Is that what it is? Yes.
There's a difference from the CBD that's obtained from hemp and the CBD that comes from marijuana.
Yeah, certainly. You worked with hemp. I mean, have you researched that at all? I haven't really looked at that, but I don't believe there is that much of a difference with what we're getting in our dispensary than what the hemp growers are producing. Yes.
Well, we go to a dispensary like yours, we're guaranteed that what's on the label and everything is what's in there.
Absolutely.
Okay, it's not as though we have to check on that stuff.
Correct. It's tested at least 3 times by independent test labs. So there's grower processors.
So if we go to a 7-Eleven in your store, it would be better to go to your store because that's guaranteed.
Yes, by the state. The state mandates that products are tested a minimum of, I think it's 3 times. Some test 5 times throughout the process of harvest to packaging. And each stage they're sending these off to an independent test lab to be tested not only for fungus and insects and pesticides, that kind of stuff, but also the cannabinoid content, how much THC is in there, CBD, all those other ones. So yes, you know exactly what you're getting, which is great, because if you're on, get it off the street and stuff, you might be told what it is, but you don't know exactly what is in it when it's tested. They could tell you something, doesn't mean it's so. You know it is exactly what you're getting when you get it from PA medical marijuana dispensary.
I don't know if you may go over this stuff you do to stop me. With the THC, psychoactive, how is that based on taking that? Is it based on hallucinations and all that type of stuff, or what?
Hallucinations with THC.
Is that what it is?
That was your question?
No, what?
So what would happen if you were to just consume straight THC?
Why would you take THC over CBD?
Well, yes, they offer different benefits. So THC is probably going to be, in my opinion, better for pain. Now, I don't formulate it myself, but I can recommend formulas that have more CBD in it to kind of limit that toxicity with the THC, the psychoactivity. So anytime you increase the CBD either higher or as the same as the THC levels, then it's a more clear-headed, less intoxicating feeling. Now there are some people...
So CBD counters the effects of THC.
Right. The biggest side effects of THC are paranoia and anxiety. So when you add on CBD, it helps reduce that feeling. Some people like the THC feeling and they can tolerate it, other people can't. So for those, I do a higher CBD content that you're still getting the system introduced to THC without it being overwhelming. But this is a good, here, when we're talking about CBD, it's the key here. And there's all these receptors throughout the body. So in order to turn those on and turn those off and start calming down the body and relieving pain or tremors, whatever would be, anxiety, there's multiple symptoms that it covers. When you buy something that's over the counter with just CBD, you're limiting yourself to this key, the CBD key, where when you're using medical marijuana, you get all the keys. So you get THC, CBD, and all the cannabinoids that I listed on the other slide that help throughout the body. So does that kind of answer your question?
The first key is what?
In this example, the first key would be THC. So the one that's the psychoactive component.
Oh.
Yeah. And you'll see that the receptors are mainly in the brain.
Oh,
And
I can see it now.
so it's a different colored blue, a different shade of blue.
Okay.
Whereas the CBD is kind of throughout the body. It also gets to the brain, but like I said, it's not psychoactive, so it doesn't give you that weird feeling that some people aren't familiar with or that they want.
Okay.
But that's how all of pharmacy works. We have a system in our body and we have to adjust it. For example, diabetes is an endocrine system and you have to take medicine to replenish what the body is not doing. So marijuana is the endocannabinoid system. So you have to use marijuana to restore the balance in that system. And this is how it's done. Yes?
So if someone would come in with Parkinson's disease, you would recommend a different dose than someone that would come in with cancer?
I would recommend, probably, it depends on the symptoms. For example, if it was anxiety for both of those patients, chances are I'm gonna go with the same product. If you're experiencing tremors and someone else is experiencing nausea, I'll probably, depending on their experience with marijuana, then that's where it kind of differs.
Okay, so there is different
Mhm.
percentages, ratios for different things?
Yes.
Okay.
Yeah, sleep, anxiety, pain, fatigue, things like that. Yeah.
You work with your doctor in order to prescribe this.
Yes.
When you mix these, like concoctions of what you're putting together,
Mm-hmm.
If it doesn't work, like for instance, and it's not something, then you have to go out and buy all new again, correct? So in other words, it's a trial and error on
Yes.
this to get the right mix for you.
Yes.
You recommend the mix, or you're the one that recommends it?
Mhm.
Okay, I see.
Yeah, so anytime, especially the first month when you're on medical marijuana, it's definitely kind of like a moving target, figuring out what's working, what's not working. You usually get, I don't know, probably a 3 to 4 week supply per bottle of whatever it is. And that differs varying products. But yes, the first dose and the 15th dose, they kind of have different responses as you get more comfortable, just like any other medicine.
You said 3 or 4 weeks supply?
Yeah.
One bottle?
Yeah.
And that's vape pen?
So it could, I'll go over the different products.
Okay.
Usually what I've seen is it's probably, no matter what the product is, it's about a three week supply.
Okay.
Some
so
can be longer.
What I mean is, if you use it every day,
Mm-hmm.
it's 3.
Yes, using it every day.
When you determine how you're gonna, prescribe.
Yeah.
Are you working with the doctor's diagnosis? Is that what you're working with to
Mhm.
determine that?
Yeah.
Not just just a patient.
So both.
Both?
Yeah.
Yeah.
I have access to, whenever you visit the doctor to get your card, I have access to everything that the doctor is recommending. From there, it's more, then I dive into the patient's experience with marijuana usually to see what they can tolerate and where I'm going to start them.
So it's better that you're a pharmacist and not some 18-year-old kid behind the counter.
Right. Yes.
Now, is your family doctor, can they give you this card, or do you have to go to a special medical marijuana facility?
So you have to go to a special doctor.
Okay.
Now your family doctor can write a recommendation to that next doctor saying, this is why I want my patient to be on medical marijuana.
Okay.
And then that physician will look at that and say, okay, I'm going to prescribe, or not, I'm going to recommend your card for, let's say, 1 year.
I can still do that process. We have some sheets over here too that explain the process.
Oh, good.
Ah.
Thank you.
You had a question?
Yeah. How many Parkinson's patients have you treated?
Me personally, I usually see a couple a week. So I usually have about 15 to 30 patients per day. And of those, I get a handful of Parkinson's patients. One I'm working closely with, and then another one, she heard about us from the YMCA actually, and she just started last week, so I'll be closely working with her too.
So 2 a week?
Yeah, probably 2 a week. Like I said, it's mainly severe chronic pain. Parkinson's, yes, a couple a week, but usually 9 out of 10 are chronic pain for different reasons.
So this isn't a wham, bam, thank you, ma'am. It's where you come in and work with us.
Yes. And it's not meant to replace any of your current medications. It's meant to see if you can get better results or decrease your medications that you're not so fond of.
Is that a smokable or is it a pill form?
All right, so let me go over that because that's in 2 more slides.
Oh,
It is in both.
all right.
Okay.
There are several forms that are legal, the state has made legal for growers to produce and send to us to provide patients.
I'll quickly go over this slide, and I just want to be a little bit thorough because terpenes are important, and anytime you smell a plant, whether it's pine, lemon, any plant that produces oils, that's the terpenes are what we're smelling and what we're tasting. So medical marijuana mimics other plants such as lemons, which is limonene, and pinene, which is in pine, and it just helps alleviate stress, anxiety, other things that add on to the cannabinoids so you're getting the full plant profile. That's all this is. Okay, so the 3 different forms that you can use are inhalable, ingestible, and topical. So when you inhale the medication, it is the easiest to predict what's going to happen because the onset is rapid. It happens within minutes that you get the symptom relief. But it's also the shortest acting. And for that reason, because you can predict that it's going to work very quickly and wear off in a couple hours, that's why it's the most tolerable. Some people don't like to inhale the medication, which is perfectly fine. So for those people, we have oils that you can put in your mouth or capsules. And other people that are dealing with pain relief and don't want the THC to go to the brain, we have topical, which it alleviates pain where you apply it. It doesn't get to the bloodstream. So if you have left and right hand pain and you apply it to your left hand, you're only going to feel the pain relief in your left hand, not the right hand.
Just a little bit, I'm not sure, you touch on the durations of the
Yeah.
onsets? Okay.
So the first one I'm going to talk about is inhalable. The biggest thing here is that it's not smoked, it's vaporized. So in Pennsylvania, it has to be vaporized. And a lot of people will ask me, well, how do you get this dry leaf, not smoked, but into a vaporizer? So next to it is this little tool, and you put the dry leaf in the vaporizer, and you turn on the button, and instead of it using flame, it just heats it up so you inhale the cannabinoids, inhale the terpenes, and you get the benefits from it without a flame. So, like I said, the symptom relief is within minutes, and it lasts up to a couple hours.
Does that, I'm sorry, does that burn your lungs when you inhale it with the heat? Don't you have to go, because I've done that with cigarettes, and I can't, I mean, it's horrible pain to inhale it.
Yes, so at first it'll probably be some trial and error. Now, there's these oil-filled pens over here, and yes, I'm not going to lie, a lot of people will say when they first try it, it does give you that sensation of burning. Now, it's not actually burning your throat, but it is irritating. After a couple uses, that goes away, and we have ways to reduce that by using smaller inhalations and by drinking water or Arnold Palmer lemonade and iced tea mixed together.
Clinton didn't inhale either, so that's okay.
But
Clinton didn't inhale.
right.
Obama did.
That's true. So the next slide talks about the ingestible formulations, and those are taken by mouth instead of inhalation. So anytime that you have these oral solutions down here, you have the option to put it under your tongue. And under the tongue is a lot faster than just swallowing a medication, because there's better absorption under the tongue. So you get your symptom relief within about a half hour to about 10 to 45 minutes is usually what it takes when you place the medication under your tongue. And then it'll continue to be absorbed throughout your GI tract, similar to what a capsule would be like. So the difference between an oil under the tongue and a capsule is a capsule takes 1 to 2 hours to kick in because we're not utilizing under the tongue first, okay? So the biggest takeaway, and what I say during my consultations, is if you take a capsule and you don't feel anything for an hour, that is perfectly normal. Do not take another capsule because that'll lead to over-medicating. You cannot overdose on marijuana. It is speculated that you would need to consume 1,500 pounds of marijuana in 15 minutes for the human body to overdose, potentially. So it's impossible, but you can over-medicate. And by me telling you don't take another capsule is ways to reduce that over-medication feel. So this is what I was talking about with the creams. There is a difference between a cream and a patch. A patch will actually penetrate the skin and get down into the bloodstream, so you will get the brain effects from the THC at that point. But topical lotions, they do not reach the bloodstream, so they just stay locally. Whenever you need to be clear-headed, for example, if you're going to work or if you're doing something that you need to be fully focused, a cream is a good alternative. You feel the effects, usually pain relief, within a few minutes, and it lasts a few hours. Whereas a topical patch will last, the patches that we sell, they're about a 12-hour patch before you have to remove it and apply another one.
If you control the THC content, how do you control that in the bud? In a leaf?
So when you're looking at our menu, we'll tell you the percentages of THC in each bud or flower or dry leaf. So there are some products that have very little THC, like 6%, and there's other products that have very high, like 26 to 30%. So you can't necessarily, it's a little bit difficult to say I am inhaling 2.5 milligrams of this dry leaf. It's a lot easier when you're using capsules and oral oils. Yes.
If you have one of those vaporizers that scents, that gives out scents, you know, like at night, can you put this marijuana in that, the liquid?
Probably just for odor, not for
any
yeah.
medicate, not for any aid.
Right. Yeah, there's vaporizers that I would tell you to use rather than like a diffuser that's just meant
That's
to
right, diffuser.
yeah, fill the room with oils.
Right.
But there's a lot of terpenes that you can put in the diffuser to give you that kind of, especially with anxiety or sleep, to kind of have that aroma of like lavender to kind of relax the body. But I wouldn't use that for THC. Yeah, essential oils. Okay. So now we're getting into medical marijuana and Parkinson's disease. Now I have the primary motor symptoms and the primary non-motor symptoms listed here. So I do have patients that have one or the other or both. So whether it be tremors or just like pain and anxiety. Medical marijuana, according to the American Parkinson's Disease Association, THC and or CBD can be helpful for tremors, stiffness, trouble sleeping or insomnia, unwanted muscle contractions, pain, dyskinesia, or weight loss. So that's what they are comfortable saying that THC and or CBD, depending on which product you use, is beneficial for, okay? But there's not a lot of studies out there because it's been a Schedule I federally illegal medication for so long.
You mean that if you take and you smoke it it encourages weight loss? I'm drinking that.
Usually it's the opposite. So it's people that are suffering from weight loss, and it's helping to restore some of that fat and muscle back into the body.
Okay.
Because it is.
I don't need that.
There are some cannabinoids that induce appetite and some that suppress appetite.
Oh, so you read that.
Mhm.
So you can customize that.
Yes, but the one that suppresses appetite is a little bit harder to find. It's actually a lot harder to find. It's just trace amounts, like maybe 2% in a lot of like the inhalation formulas. So with the good comes the side effects. So especially with Parkinson's, if you're having trouble walking, when you're first starting this, I always urge someone to be careful. Whether the THC is just a little bit or the THC is you know, all of, or the major component of your product. Sleepiness, confusion, difficulty concentrating, mood changes, gait imbalance, and then just kind of feeling like sluggishness. That's something that you probably expect during the beginning of it. My job is to limit that. My job is to limit the side effects and to improve the symptoms. So that's what I work with you to do. All right. So now we're getting into what to expect when you get to a dispensary. And that requires a valid medical marijuana card, whether you're a patient and you can go in there and get the products that you want for yourself, or if you can't make it to the dispensary, you have what we call a caregiver, and they go and pick up what you would need and you would stay home. So when you first get there, there's initial paperwork, and that just says your name, your qualifying condition, the symptoms that you're experiencing, medical marijuana usage, and I take that paperwork and I look over it so I understand kind of your history once again before you, yeah.
Apparently we're not going anywhere until we get our marijuana cards.
Right.
Could you go through a step-by-step process on how you would acquire one of those?
Yes, we'll do that after, because we have papers over here that'll explain that. Yeah, so the purpose of my presentation is to kind of give you the overall view of what medical marijuana looks like, okay? And then you'll sit down with a pharmacist. Usually it's me, if you go to the Cranberry location, unless I'm off, which I'm usually there 5 days a week, unless I have a vacation, which I had last week. We'll go over the products that we have. I'll answer any questions. I'll give you my contact information, so in case you have a question that you forgot to ask me, then you just email me, or you can call and leave a message and I'll call you back.
Let me touch on one thing real quick. I mean, you touched on this before. There was a question about getting in and getting out. Some appointments, consultations last 15 minutes. Some even last 5, but they can last 40. They can last 30. We don't rush you out the door. We look at your medications, talk to you about what are you trying to solve, what's your comfort level. You know, we spend as much time as we need to, but you can answer all of your questions. We're not there to just get you in and throw you out the door. Now, if you come in on subsequent visits and you're like, you know what, I know exactly what I want, and I don't need to talk to Andrew. Maybe I'll say hi to him, but I just I know what I want. It's on the menu today. I'm just going to come in and get it and leave. You can certainly do that. We don't want to keep you there longer than you want to be, but we also don't rush you through.
How do we pay for Andrew's time?
There is
Like
no
if
charge.
he spends 45 minutes with you or he spends 5, you know, is that available?
There's no charge to see our pharmacist ever.
No charge.
So the first consultation, the first visit, you're required to see a pharmacist for however long you need. If you come in again and want to see him again, if you skip 3 visits and then decide you want to see him again because maybe you titrated off of medication, maybe you got a new medication, you just ask to see the pharmacist again, and there's no charge to you. The only thing you do pay for is the medication, and I think I'm not sure if you talked about that or not about that, but it's out of pocket. So the insurance, because of the Schedule 1 and the federal government, they don't even want to touch any of this right now. So.
And you have mentioned, since the federal government don't recognize marijuana as a legal means of dealing with Parkinson's, how does that affect my guns if I apply for a medical marijuana?
That's a very common question. And we've done a few talks called Know Your Rights at our dispensary in Squirrel Hill. and had attorneys come in and who know Act 16. Act 16 is what governs this program in Pennsylvania. They know it in and out. And the big question there is, if I have guns already, and can I go get a card? Yes, the answer is yes to that. And will they come take my guns away? The answer is no to that. Nobody's coming to take anybody's guns away. Now, this could go in a whole class session just on this topic, but if you are looking to purchase a new gun and you are already a patient, I'm thinking you fill out. There's a form. I'm sorry, I don't know the name of the form. The ATF form, I believe, that asks you questions on there like, do you abuse illegal drugs, or do you take things? And I think it might say something like, this includes medical marijuana. Now, you never want to lie on a federal form. It's a felony to lie on those forms. So I'm not going to tell you to lie on there, but you just have to know that if you lie on a federal form, that's a felony. So it's kind of like if you're thinking of buying a gun, maybe buy the gun first before you become a patient, that type of thing. But nothing will happen to exist if you are, have your existing firearms and you're going to fill out a form. Nothing on the form asks you if you own any weapons or anything like that. Also, the
How
state
about registration of your weapon? Say if I have 30 weapons, do I have to turn in each one of those?
No, you don't. No. It's up to the state, I guess the state police. The state police systems and the medical marijuana PA Department of Health systems are not connected at all. For instance, if you get pulled over, the officer, when they look up your plate and stuff, they do not see anything that says that you were a medical marijuana patient. And so those databases are not. The Pennsylvania Department of Health was adamant on making sure that link wasn't there. A lot of privacy issues there. It's health privacy. It's like your medical records in general, right? They can't look up and see your medical records from your hospital. They're exactly the same idea. You're welcome.
So that leaves us with the follow-up. A lot of patients will come back and talk to me the second time and tell me what they like and what they don't like, and I can make another recommendation based on that. And then the third option when you return to the pharmacy or the dispensary would be what we call a fast track, and that's if you're in a hurry and you don't want to talk to anybody or have any questions, you just tell us what you want to pick up and they make it for you, and then you're out the door. So that's a faster process. And these are some pictures of our dispensary. That's the outside location, the first one, and then reception, that's where you'll do your check-in and get your intake form, and then you'll meet with me, and then that's the dispensary on the far right. And it kind of just looks like a jewelry case showroom, but instead of jewelry, it has medical marijuana, and that's kept in a safe. It's not on display because we can't open any products, but you will be able to see the package labeling to know what you're getting.
What's awfully expensive?
So I would say it ranges anywhere from $12 to $100 depending on the product.
And the look and feel, we didn't want to make it look like call them headshots, right? The bombs everywhere and stuff like that. That's not who we are. We're owned by physicians and pharmacists and business people. Those are our main investors. So we took a very medical approach to this. I can't say that's going to happen to every dispensary. Our competitors are like that. They decided they do their own way of making things look a certain way. We went for like the medical spa feel.
That was very professional.
More not too much like a hospital. You've probably been in that environment too much, right? Or a lot, and so, but not so relaxed that it's uncomfortable. We try to make it like a spa type feel.
So there's a couple questions.
Yeah. It is cash, and we take debit cards and checks. No credit cards though. So if you have a PIN on your card, on your like a debit card, we can take that at our registers. You can put your PIN in. They act like ATMs, the registers.
How many times interact with medications
So yeah, when I sit down with you, I'll look at your medications that you wrote down. So I have to have an accurate list, and then I'll go over like an interaction check with all of your medicines. I'll actually do that within your medicines, and then adding on medical marijuana. For example, a couple weeks ago, I had a lady that she couldn't. I said, "Do you want to try the oil?" She said, "I can't taste anything anymore." So I looked at her medications, and I was able to find an antibiotic that can cause taste disruption. And then she went to the doctor and she was removed from that. So she came back last week and thanked me for that. So that's coming from Giant Eagle, they stress a lot of interactions. So I have that background too. What?
You're talking about price, so you guys offer 10% off for veterans?
Yes, we do. 10% vet discount. And pediatrics.
Where's John Fetter?
He's on tour.
Yeah.
I thought he was gonna be here.
Yeah.
Do you cover, is any insurance involved in covering this?
No.
Okay.
No insurance.
Any free samples?
No free samples.
Can't come in and have a puff,
We have
bottle
several.
fill,
Not yet.
put one under our tongue.
Recreationally out west, yes. A lot of people will go into the dispensary, get what they think they need, and they will share it with each other because it's recreationally. But in Pennsylvania, we can't do that yet. I don't know who was next, but let's start.
I just wanted to know if any product helps, central tremor.
Yeah, so that's kind of what the studies are being done, whether it be Parkinson's or other research companies figuring out what dose of what is good for people with that certain condition. That's what we're kind of waiting for. So that's my job to kind of give my best guess of what will work for essential tremors, and then we kind of have to fine tune it from there.
I've tried so many different products, and it's helped with the Parkinson's tremor, but not with the essential tremor.
Yeah, and that's just kind of how the medication goes. It's great for a lot of things, and some things it can't help. So that's the other important thing. It's not like the miracle drug that everybody hopes it to be, but it is fantastic. There's 21 different conditions that it's good for, but some of the things it just can't touch.
And they're looking to add a few more. They started the program with 17 conditions last February, and they added 4 more last year already. And then they're looking at adding anxiety and Tourette's as well. I'm not sure when that's coming. That was submitted to Dr. Rachel Levine, the health secretary, for approval. So we're just waiting on that.
Let me do.
That one lady's question.
Yeah.
I'll tell you what, I had a DBS, and that took care of my tremors fantastic. You know, I had tremors, I couldn't even use this left hand before I had DBS. I'd carry it like a cloth. And I could use it now and do everything I did, but I know that's a different topic, but I'm saying instead of doing the temporary fix like the marijuana or something, I would recommend that she looked into the DBS because it's just fantastic. Every
Yeah.
time it twitches and that, I go back and they tweak it a little bit more, and it really does a nice job.
Awesome.
So,
Good.
What about driving? If you have a medical marijuana card, do you have to turn your driver's license in, or is it just a cautionary, just like with any other pain medication or something?
Yes, same with any other pain medication or alcohol. I went over like how long it takes the effects to wear off, whether you inhale it, whether you use an oil or a capsule. So you never want to drive when those effects are going on because it is impairing. But once they wear off, then you're more than welcome to drive. Let me get to him and then I'll come back to you. Yes. Well, let me see. In the penguin shirt.
What information should be on the card that the doctor goes
Information should be on what?
medical marijuana card that you carry?
So the card basically looks like a driver's license, except it just says patient or caregiver at the top, and then the back has a barcode. When we scan the barcode, that gives us all the information from the doctor's office, basically. So really all it'll say is your name, your picture, and medical marijuana card.
Yeah, and it just says issue date and expiration date. It doesn't have your address or anything like that on the card. It's very
Physicians
plain.
have those in the office?
The physicians will certify you, and I can go through, I'll walk through that process, after these questions. The certifying physician, goes through the logistics of certifying you with the state, and then you go online right after that and pay for your card to the state, and the state mails you the card. So you get certified at a certain physician's office, but the card actually comes from the Department of Health. About less than a week, gets delivered.
What happens if you're driving, if we're going to another state, let's say a southern state that doesn't approve of anything, and you are in possession of the marijuana, but you have a medical marijuana card, what happens to you?
Right, so you're not permitted to take it out of Pennsylvania borders.
Okay.
Okay.
Basically crossing, state lines.
Yes.
And thinking about federally, there's not borders, there's not federal, once you cross, you become, like you think of federal, so you're breaking a lot of the ability. Now, if you do, visit another state that takes
Medical marijuana.
Pennsylvania medical marijuana cards, like reciprocity that way, in a way, sort of, like one way. No, Pennsylvania does not accept any outside medical marijuana cards right now. Others, there are a few other states, I think Michigan is one of them, I'm not sure all the other ones. Probably Colorado and out west, but they take PA licenses, or IDs, I'm sorry. We just don't take everybody else's. Now, yeah, traveling to another state, if you go to another state, even if they do accept it, that's where you would, maybe, if you're there for vacation, buy your medicine there. Don't take your medicine with you, I would say. Lawyer would definitely say don't.
Let me jump to him in the back, and then I'll come back up to the front.
You need your PCP to do this, or your neurologist?
Whoever the prescriber has to be able to write for the medical marijuana card. Certified, yes. So whether it be your PCP, let's say it's Dr. Smith who's going to get you your card, and your doctor is Dr. Brown. Dr. Brown can write you a recommendation to go to Dr. Smith for these reasons, and then Dr. Smith will certify you.
So you have to listen to the guys for certified?
Yes.
Yes, this piece of paper here has a website on it. The Department of Health, PA Department of Health website has a find a physician section, and it's broken down by county. So you just look in the county you want, and you can see all the. You don't have to visit. And what he mentioned, your PCP doesn't necessarily have to send a recommendation to that doctor. You're able to just go to a certifying physician on your own. Outside of, we prefer you work with your team, but you're allowed to just go to any certifying physician with your medical records, displaying one of the 21 conditions, and they can certify you. But it's nice to have your whole team involved if they're willing. Even if they're not willing, or they're not willing, but if they're not on board with it, you can still do it. It's up. Your care is in your hands.
So you have to take your records with you, or can you just walk in and say, I have Parkinson's?
You would either take them. It depends. When you make an appointment for these certifiers, sometimes they'll ask. Sometimes they'll be in the same hospital system as you already are, so they can grab your records. They can pull them, but they might say, "Can you contact your office and have them send them over to me?" Or you can ask your physicians, because you can always get your medical records sent to you, and then you can bring them in yourself. It's up. Just find out from the certifier. That's easy. Yes.
Is it policy or what? These other states will not accept a medical marijuana card even though it's legal in their state?
I think part of it I think is policy, but like for instance, the database we use to not only check patients in but also do inventory, and it's all one system. It's called MJ Freeway. The state mandates that we use this one software system that we use as dispensaries, but grower processors must use it as well. It's called seed to sale. They can track a seed the whole way to a finished product that's sitting on our shelves. So whenever somebody walks in the door with their medical marijuana ID, we scan it and it looks them up right away in the system. If somebody brought in their own...
Systems aren't intertwined where they can follow up on it, is that it?
The systems across the country are not intertwined. Like MJ Freeway is just one software vendor like this. Different states, some other states use MJ Freeway, some other states use other ones, and they're not all connected. They're just separate systems. So when somebody brings an outside of Pennsylvania card and we scan it, it would say, I don't recognize this card. So there would have to be, they would have to do a lot. I think someday maybe they'll accept it, but
So that's the primary reason why they don't accepted?
I think so. It's logistically
Yeah,
would be
it's not-
hard to do right
Right.
now, and they just want the program to just focus.
I got you.
It's only been a year in selling, open the doors. It got passed in 2016, but the doors didn't open
So
until.
abide by the speed limits and et cetera when you're out of state.
Exactly.
I mean, there are also differences in laws.
Absolutely.
You may know that Washington State is basically obsoleted their medical marijuana program by enabling recreational. So they're kind of in limbo out there.
They are. When you introduce a recreational, it's unclear of what Pennsylvania is going to be like. We don't even know. Whenever recreation happens, which I don't think it's that. I mean, you see Fetterman out there running, he's getting people's feedback on recreation, really. But I still think it's years away. I don't think it's a year away.
But it's a legal morass. I mean, every state has their own idea of how to do it, and there are recommendations that states do the same things, but like
They don't
anything
have to,
else,
yeah.
the states are independent and they do what they want, and the problem is the federal government is against the law. So the states are just going it alone, and everybody does something different.
Yes, and once it gets off of Schedule 1, which I think will happen before even Pennsylvania gets legal, I think recreational, once it gets off Schedule 1, even if it's Schedule 2 or 3 or something like that, that'll open up more things across state lines. Things will get better, and now with research and things like that, I think we'll get even better. But yes, you're right. We're going to be opening in other states. We're actually opening in North Dakota, working in West Virginia, and different states right now. We already have them lined up. I have to learn from a marketing perspective. There are rules around marketing even. I have to look at, okay, what are North Dakota's rules? What do I have to follow when I do a brochure in North Dakota versus Pennsylvania? It's going to be different, lots of different conditions. There won't be 21 conditions probably. We have a lot of conditions that are qualified. Some states have 2 or 3. It's a lot of rules, and you're right.
You have a question?
Yes.
First of all, I want to compliment Andrew. I happen to be with a friend, and Andrew was so thorough and kind with her, so I give you
Thank you.
accolades.
Thanks.
For myself, I would appreciate coming from your background, pharmacy. I wrote it down to make sure I asked it up. I have not started the medication, so I'm watching it on the shelf so that I keep looking at it, because I react to a lot of things. And then I come and see someone like you, so I appreciate any beginning tips versus one and the other, so I appreciate that. And any other thing I would share is I tried a CBD tincture and after 2 days I felt agitated, and I didn't, so I put it away, but then I thought, oh, maybe it's me, I'll try again. And then I woke up in the middle of the night, bright-eyed, and I didn't like that because I'm a sleeper, and that's when my tremors stopped. So I appreciate anything. I'm just sort of at a crossroads and I don't know which road I should take.
The medication that you didn't start yet, that was from the pharmacy?
That was from my neurologist and I had it filled at the pharmacy. And she knows I react to things like even steroids, so it scares me a little bit. So she said to just start like with a quarter tablet, and I keep looking at it, oh, I'll exercise today, oh, I got through today, oh, I'll keep doing it today. So that's been going on for a while, so I appreciate your input in any side.
Yeah, after I'll probably just sit down with you for a few minutes and give you some recommendations. Okay.
Just a note on that, there's 2 basic kinds of cannabis, and one tends to make you more awake and aware and such, and the other is will kind of mellow you and make you sleep better and such.
Yeah.
So you have to decide, which way you go and when to take it. You don't want to take the kind that makes you awake and aware, like ready to go to bed.
Yes. So that is more of a sativa plant. And when they categorize marijuana into usually 3 different categories. So whether it be inhale or tincture or oral solution or a capsule, they can take the plant. The plant that has skinny leaves is called a sativa, and it's more uplifting, better for daytime. And then the plant that has fat leaves is called an indica, and that's more relaxing and calming. So depending on when you want to use it is which product I'll recommend. And then there's a hybrid, so it mixes both, so you get the benefits of both. And that one you can usually use anytime during the day. Yes.
Is this like a one at a time, one a day type thing, and is there a better time to take it? You know, in the mornings or at night or whatever? I mean,
I would start when the symptoms are the worst. So if it's not sleeping, then I would probably recommend it at nighttime. If it's daytime problems, then I'll recommend it during the day. It depends on, so for example, the oils that you use in your mouth, those last about 6 hours, so it would be perfectly normal to use that 3 to 4 times a day. Whereas a capsule lasts 8 hours. So it would probably be better for someone to use that 1 to 3 times a day.
I had a
Okay.
particular episode where it kind of set me back in my Parkinson's and made it worse. And what I was wondering, I'm just on the process of getting better. You know what I mean? Working with physicians to, you know, build up my medications and things. So what I'm wondering, is it a good time for me to work with someone like yourself when I'm already going through medication changes? For like, you know, I'm suffering with dyskinesia and, you know, that's anxiety. I'm on both scales. Do you know what I mean? I'm in between for you. I mean.
Yes and no. It would be
Okay.
nice for you to understand or to better predict how your medicines are going to work before getting in there. But if you're at a point where you're transitioning to another type of therapy, adding this on would be an appropriate time too. So it just kind of depends on what's going on. If you have a lot of anxiety, then I would probably say using medical marijuana tends to reduce that anxiety better than most medicines that I've seen, to be honest with you.
How about dyskinesia? Is that part of anxiety? Would you consider that?
I wouldn't
No.
consider it the same, but it would be definitely appropriate to use medical marijuana for dyskinesia and or anxiety. Yes.
So are the pills divided into pills that are based on sativa? What was the other?
Yeah, we have pills that are sativa, hybrid, and indica. Indica, yes.
INDICA.
It's on this little bottle, but it's really hard to see. We don't even carry this brand. I just liked that they broke out indica, sativa, and CBD because it really hits all three of like the pathways that you can go.
And the indica makes you more drowsy.
Indica is more of a relaxed body feel, so that's why people tend to use that at nighttime. But you're not limited to nighttime. That's just, you know, some people like indicas during the day and sativas during the night. So it just depends on the patient.
Sounds complicated.
Yeah, my day is kind of a puzzle that I have to put together for every single patient. So that's why it is complicated, but you start to see like a pattern that works for people, and that's what I stick to.
And that's why he spends time and take as many notes as you want in his office and in the consultation until you're comfortable and just keep asking questions until you're ready to pick up the medicine. One thing that you mentioned, indica, you talk about people call it in the couch indica, like you're in the couch, like relaxing. Easy way to kind of remember indica is a little bit more sedating than a sativa.
Yes.
Just another little thing, just emphasize, first of all, you cannot overdose. And the worst thing that can happen is that maybe you have a couple of hours of being that high feeling or whatever, or if you're having an adverse reaction to something like the last couple of hours, then it was gone. It's not like there's something.
Right.
Some medications, you know, you have a terrible reaction to, and you're gonna end up in the hospital. You're not gonna have that. So if it's not working the way you want it to, it's going to be gone within a couple of hours.
Like overdose in the sense that you took too much of a dose, you know, like people hear overdose now and they immediately think that there's something like that or things
It's like
happen to your
if there's
nervous
too much
system.
THC or something, you're getting these funny things, you're gonna be gone pretty quick.
Right.
The
Either
next thing is
you're
just
uplifted
mellow out a little bit.
or you'll be tired.
Take it easy, yeah.
Right. Right.
You're gonna be really tired for a couple hours.
And there are ways that you can counter some of those with CBD.
Right.
And there's other things, drinking some water, stuff like that can help alleviate some of that feeling too.
We're gonna.
Any concerns with long-term usage? Do we know enough about it for using it over periods of time, research-wise? Any concerns with affecting other systems long-term, tolerance, things like that?
As for, a lot of people ask me if they're going to get addicted with long-term use. It's less addictive than caffeine. However, the body becomes, used to. If you drank a cup of coffee every single day for 2 years and then you stop, chances are you would get a headache, you would be agitated, things like that. So that's kind of the response that you get from marijuana. It takes a couple days to restore that balance of not having marijuana in your system. So I would expect headache, agitation, some type of mood, like just general not happy. But you wouldn't go through withdrawal symptoms like going off an opioid or something like that. The other nice thing is with opioids, it causes constipation. With medical marijuana, it does not, because it's a completely different set of receptors that don't deal with the constipation. Usually, it can cause constipation, but it's not one of the big side effects that we're looking at, where we are with traditional pain medicine. And yes, heavier users will have to take a break, because all those cannabinoids go onto that receptor, and if you're doing that every single day, the receptors get desensitized, so they kind of go inside. So the next time you use a dose, you have to keep using more and more and more. For those heavy users, they will have to take a break to rebuild those receptors, and then they can go back to it. Then the third thing, this is very uncommon. It's basically where you're vomiting nonstop from marijuana. Very heavy users for probably longer than 2 years. And the only thing that's relieving it is a hot shower. So that's how that is diagnosed. A lot of vomiting, you have a history of using marijuana a lot, and the hot shower relieves it. So for those people, you just have to completely stop marijuana, let your body get back to its normal balance, and then you can continue.
So that's mostly though heavy dosage.
Heavy
over a long
users,
period of
yeah.
time, not necessarily what we're talking about
Right.
today.
I'm talking very heavy users. People that are, probably inhaling throughout the day, all day long. Yes?
My card expires in July, and at the beginning you said something about have a 2-year or more.
It's usually 1 year. I've seen 6 months, but everybody is usually 1 year from the date it's issued.
You should get an email from the Department of Health. July, you said? Probably next month, you'll receive an email to the same email address that was used to sign up your account. And it'll say, hey, you're 60 days out, you need to renew you should go and think about renewing your card now. So.
When she got her card, there were not a lot of doctors walking around who had been certified. Is that improving?
Yeah, do you know how many doctors there are currently?
I think there are about 1,000 or so now. I mean, every couple of weeks, the Department of Health updates their document on their website with new physicians. Some physicians are certified, but they didn't opt to show their name on the list, just because they wanted it to only treat certified current patients. They didn't want to open the doors to everybody coming to their office to get certified. So, but there are several. So if you're looking at Butler or Allegheny County, you're going to see a lot of doctors on there, more than there were a month ago, 2 months ago, definitely 6 months ago. They just keep coming.
So what website do you go on?
Yep, on this handout, I'll give this to you at the very bottom. It's very easy, medicalmarijuana.pa.gov.
Okay.
And
Just go on.
yep, and it'll say 4 dispensaries, find a physician for caregivers, and you just find a physician, and list of practitioners it'll say. And we can make more copies of this if we don't have enough, but I think we do. Yeah, it's right on that website.
Hey, Dale, do you mind if I mention some of the things that they're offering up in Harmonville?
Let's make sure we get all the questions answered for these guys, and then
I
yes.
thought they were done.
I like, you say you're there 5 days a week, are you open 7 days?
Just 5. At my
Just 5
location,
days
5.
a week? 5 days.
Yep.
Squirrel Hill 6.
6.
Mhm.
In Greensburg, we're open 5 as well. Now you can, even if you get your consultation in Cranberry and you happen to be in Squirrel Hill area or Greensburg area, you're welcome to come in and purchase medicine at any of those locations, and you don't have to do
You're in
another
the system?
all in the same system.
So
yeah.
if I wanted to go in, if I was there, just say,
Mhm.
I was Squirrel Hill,
Mhm.
and I went in, and I wanted exactly what I was getting up here, then they could fill it there?
Yeah, usually we have the same. Our menus are all online of all of our products, and you can check it prior. But typically, we keep the same medicines across all locations.
So they would go into the system and they'd know exactly what to make up for me?
As soon as they scan your card when you come in, you can ask. Say, I'd like to get what I picked up last time, or if you have a box or something that you've had before, or a picture of the box that you have at home, we can just look at
So
it.
there's a file on you. in the
Exactly.
System that
Yes.
will notify the pharmacist.
Exactly, and
When you got it and what you get and et cetera.
that's right. And like I said, you don't have to see another. Like if you go into Squirrel Hill, you saw him a few times, and then you went to Squirrel Hill. You don't have to see a pharmacist again if you know what you want. If you want to, you can, but you can just come in and pick up your medicine.
Thank you.
Are we the only company that's available to do this in Pennsylvania?
No, there's several. There are. When we opened, there were 2 in Western PA open on the first day. We were one of them. There was one up in Butler, and now there's several other ones opening. They have licenses to open. They just didn't get to open on time, or now they're starting to open. East End, Washington, PA. We're going to open in Lawrenceville and Washington, PA coming up this year. Different brands coming out there. You can go anywhere. Even if you see him, you're welcome to go to any other dispensary that
There's
you
a
want.
pharmacist in each one?
Every single one has either a pharmacist. We're required by law to have a licensed pharmacist, or a doctor on board, on site, or a nurse practitioner. We chose to go with all licensed pharmacists across all of our locations. So that's what we have. Other locations, I've seen typically pharmacists. I haven't really heard of any staffing with MDs, but they could be out there. And if you
They're
do,
like a doctor anyway. All right?
yeah, exactly.
Yeah, we're all doctors,
MD, yeah.
usually.
The education is.
Right, exactly. Now, if you do go visit somebody that's another place that's not a Solevo, they may require you the first time to see their pharmacist first again, because they want to get to know you. So, and it might not be the same exact experience that you got at our place. Not to say it's better or worse, it just might be different. We have a way of working. It's our way of working, and we stick with it. So.
You mentioned, well, that's true too, yeah. I was just thinking, you mentioned you are in other states, but even so, you still couldn't obtain any because of the.
Right,
laws and
right,
everything,
right.
so it is, sorry.
It gets there are gray areas. I mean, this is so new,
Yeah.
and we struggle sometimes with some of the gray areas, but we just have to go to the Department of Health and ask questions, and over time, it'll start getting a little bit more.
Make a change.
Yeah, well, that'll be a big one.
Yeah.
But the PA program is very much focused on education and research too. They're partnered with hospitals. Hospitals are part of this act, where they can do studies and have their own growing operations and everything. So they want to be the #1 research state in the country, Pennsylvania, and they're doing a pretty good job at it, I think. So, sure.
You want to tell them again where you're located? I know it's just right close by, but are they able to stop in and look, or is that?
You need to have a card to
You
come
need
in.
to come in.
Typically, like if you come in for some information, that's okay. Yeah,
Yeah.
certainly. And a lot of windows in the Cranberry location, so you can actually come in and you can really see how it's laid out. And you've seen it, right? We could, we can certainly. You can, if you pop in, we can give you some more information and show you around. We just can't show you. We have the other, like the dispensary room. There are certain rooms that we are not allowed to let anybody in unless they have a caregiver card or a patient card by law. We're not allowed to have them in there. So this room here. So.
Sorry.
So you have like a Walmart greeter in the front?
We have a reception here. We do have, just to let you know, we do have security, and they're on staff the whole time. Some are in the back, some are in walking around, and that's just. I mean, they're very nice. They're like teddy bears, right? And they'll converse with you, and they'll talk to you, they'll get to know you, but it's just a precautionary type thing. It's nothing to be alarmed about. But yeah, you come in, you see the front desk. They'll check you in. They'll give you some paperwork, and again, you said you'll visit with him. And then after that, you go into the dispensing area. We have patient care consultants in here, and what they do, and they're not just cashiers, right? They'll not just take what Andrew talked about and just pull it out and sell it to you, and make the transaction. They actually can answer a lot of questions for you as well. So he might give a directional day and nighttime. Here are 2 or 3 for day, 2 or 3 for nighttime. They can pull those out and talk to you about, okay, these 3 for daytime, these are the little differences between these 3 versus these 3, that type of thing. So you'll get another education session in here as long as you like with the patient care consultants, and their experience comes from working in the industry in, say, other states. Some of them were growers, some of them worked in dispensaries out west, that type of thing, and when it became legal here, they moved back home, and we picked them up, brought them on board. We also train them. If they don't have that experience of working in other places, our other staff trains them constantly, internal training, whether it's our Director of Operations, Rocco. He's in the Scroll Hill area. He's worked in dispensaries. He's managed dispensaries out in San Francisco. Annie Corbin, our pediatrics director, she grew in Colorado. Took her child out there to medicate to heal. She has epilepsy. Came back and she trains everybody. So we have very, very skilled staff in here that can dive into lots of conditions and symptoms as well. Yes.
I have a question for Andrew. You haven't started any Parkinson's medications, one of the mill ones. Does the medical marijuana help for stiffness?
Yes.
Okay. So you could do that in lieu of starting on levodopa?
You could. Yeah, that's kind of what the Parkinson's Foundation was saying.
She should wait to take her carbidopa, levodopa, you're saying?
To wait to take it?
Yeah, she said she hadn't took it yet. I disagree 100% with that.
No, so it depends. Now, based on the research, they are not saying use medical marijuana instead of carbidopa, levodopa. But if you want to try to control your symptoms before going on that medication, then that would be up to you, and I would say, yes, you could try that.
And it would alleviate some stiffness potentially.
Based on...
So with that though, I mean, you gotta be careful, to me, you gotta be careful in that area, because carbidopa, levodopa is the number 1 thing Parkinson's patients,
Right.
all of us take.
Right.
And everything's tailored different to each of us. So I'm not ready to jump on this medical marijuana bandwagon to cure all 1,000, cure all of everything. I think you can help out, but you remember, you have a physical therapist, your exercise program you do, your neurologist, you give pharmacy information, you have a group of people, everybody's catered different.
Absolutely.
You can't say your symptoms are necessarily going to go away. Mine don't go away every day. Some days I eat bad all day, but that's part of the deal with Parkinson. They find the number 1 thing is exercise is the number 1 thing that slows Parkinson down. The Delta therapy is going to help slow that down. I'm saying you have to look at the other areas too to put in together.
Right.
It's not like we have on this drinking the Kool-Aid, it's going to cure everything. It's not going to cure everything, it can help.
No, never.
See, you should
Yeah.
say not to start with bank. I personally see, your neurologist has a lot more information than you would have. Now,
Right.
That's dangerous to me.
If you're going through the procedures and other things like physical therapy and eating good and taking other medicines that are beneficial for you, adding on medical marijuana could be the answer to your symptom relief. Now, I'm not saying it's going to reverse the disease state, because they've already proven that that's not the case. But there is some pain, stiffness, anxiety that comes with Parkinson's disease that, yeah, maybe someone wants to take an Advil every single day for the rest of their life, but it also increases the risk of stomach ulcers and bleeding. And some people can't take that because they're taking warfarin or Xarelto. So there's a lot to consider the safety profile of medical marijuana based on traditional medicine and the effectiveness.
There's going to be a lot of adjustments along the way. I mean,
Yeah.
I'm not saying it's not bad. I mean, you can help out everybody. Everybody needs help. It's great for help. But you're going to keep all the other factors involved, your exercise, everything else, just to make sure. So I understand what you're saying. I work in health too, but I mean,
Mhm.
you gotta be aware, there's a lot of different factors involved in Parkinson's.
Yeah, definitely. If I were to start somebody, on treatment, medical marijuana would be probably in addition to the Cinemet.
I just wanted to note that, when she was talking about levodopa, from our understanding, you cannot, once you get on levodopa, you don't get off. And
Typically.
my wife was taken off, and she couldn't move for 4 days. And
Mhm.
now, because of that, you have the dyskinesia
It's
really
progressing.
bad for a while.
Mm-hmm.
And,
So they added another medication, so
Amity.
prolonged use of taking carbidopa levodopa, you are subject to dyskinesia
Mm-hmm.
and other, symptoms besides, because it hit me very hard, so.
Mhm.
It's just food for thought. I mean, if you wanted, if I would have known about marijuana, medical marijuana before I took the carbidopa, I would have taken it first. You know what I mean? If I had, I would have taken the marijuana
they didn't
first.
have it.
But they
Mhm.
didn't have it then. That was 2006.
Mm-hmm.
So, if I can just help one person here, you know what I
Mhm.
mean? If they're being diagnosed with it, I'd go with medical marijuana. Because there's no, there might be side effects, but there's not any problem with prolonged use other than headaches maybe, or, what you said, maybe mood swings.
But
Mhm.
the presentation we went to a few days ago, he had noted that you do not get off the levodopa once you're on it.
Yeah, normally. If someone is experiencing some pretty bad side effects, then obviously they're going to stop it
But
because.
if you've taken it for such
Yeah.
a long time,
Mhm.
like myself, I've taken it since, that's 12 years, or, it's a long time to
Mhm.
take medication. Soon, your body takes a toll.
I think you've actually misinterpreted what someone has told you. When you start taking levodopa or Cinemet, it's because your symptoms are severe enough that it's necessary. And that's why you don't get off it. It's because if you get off it, your symptoms come back.
Yeah.
It's not addictive and it's not accumulative. They just disproved that. So I think you may have misinterpreted what they told you. If you're severe enough symptoms that you need Cinemet, you're gonna stay on because the benefit is substantial.
There's no improving side effects, or don't leave it over either. There's never feeling for it.
We just have about another minute here. We're going to tie up since another group coming in. Does anyone else have any quick questions? Are you guys available if they have any individual questions for a little bit? So, great. Thank you guys for coming in.
Thank you.
Appreciate it. It was great.
Thanks.